So when we start looking at the big picture, I'm going to go through some things that are important. First, yes, iodine helps the whole process of making thyroid hormone. T3, T4, T3 being the active component of thyroid hormone. Yes, iodine is very important for treating hypothyroid, and I'm going to also say hyperthyroid. Now that may seem as a paradox, but it isn't, because some of the hyperthyroid conditions are because there isn't enough iodine, so the thyroid goes into a hyper state trying to draw more iodine. Now I work very carefully when I'm doing this, but I will give iodine, and that is actually a treatment. There may be a treatment for hyperthyroid, but one has to be kind of cautious. Okay, the next little step is it's a major player for apoptosis, which is cell destruction of dead and dying cells. And it's really key for being healthy. In a fast, the rate of apoptosis increases. Okay? That's one of the advantages of fast. So in that process of supporting apoptosis, it creates an anti-cancer protection. And that's kind of what we're seeing. Like in the Japanese women have 1/3 less breast cancer. In terms of brain function, the brain cells normally have 3,000 to 5,000 mitochondria, which protects, well actually in terms of cancer, which protects against cancer. In an iodine deficient person, there may be 200 to 300 mitochondria. So the cells don't have enough energy to protect against the cancer energy. So iodine ups the mitochondria production and therefore gives you a greater protection against all the cancers. And that's actually pretty significant. As I said, it also increases the mitochondria in the brain cells and has definitely been associated with an increase of 13.5 points in the IQ in adults. I also mentioned, in terms of brain function, that iodine deficiency is one of the 2 leading causes of imbecile, which is less than mental retardation, what we call cretinism. Are people familiar with that term, cretinism? You've heard of a cretin, right? It's a person's very, very low functioning mental state. Well, iodine deficiency is a major, one of 2 major causes of cretinism in the world today. So this is really important. So any pregnant mother, didn't say it right, any woman that wants to get pregnant really better build her iodine, and certainly during pregnancy, because you want your baby to have the highest amount of iodine, therefore the highest amount of brain function. So I'll put it that way. Okay, in terms of breast cysts, fibrocystic breast cysts, and breast cancer, it significantly reduces fibrocystic breast disease and breast cancer. Remember, the breasts are a big source or location for iodine. So it's actually quite important. And I see, just like an epidemic of fibrocystic breast disease, and invariably the women are deficient in iodine. And usually you see it in older women, but see it in women 20 years old. It's like, what is going on? We have a pandemic deficiency in iodine. That's what's going on. So this is a very important protection against fibrocystic breast and breast cancer. And it affects other cancers too, prostate cancer and so forth, but the breast is actually a big issue. In terms of lymphatic system, iodine is the most powerful lymphatic cleanser. It is the most powerful antibacterial, antiviral, and antifungal thing we have in the world. So when you take it, it will be cleansing your lymphatic system, but also knocking out the toxins, bacterial, viral, and fungal toxins in the system. So it's very, very potent protection against really all levels of microbe disease. I'm going to mention something only because we're exploring it, and I'm not willing to make it more than exploration as a statement, but it seems to be the best treatment for parasites. And iodine enemas may be the single best treatment for parasites there is. Everybody is traveling all over the world. Everybody's subject to getting parasites. And my research is, at this point, is saying, a kind of a series of 5 or 6 days of iodine. We're using the word Illumodine because that's what we have. Enemas, let's say twice a year, may be the simplest and best way to continually eliminate parasites in the colon and in the blood and in the liver. It may be by far the best anti-parasite treatment. I'm not willing to make that as a hardcore statement, that's why I say maybe. But so far as I can tell, it's looking pretty good. The protocol that I use is 1 dropper of the Illumodine in an enema, and usually it's almost more of an implant. It's like not 2 liters, but a half a liter, or you may use, and you leave it in all the 4 positions, 4 minutes, 6 minutes, something like that. Next day, 2 droppers, working up to about 5 droppers. I know some people have done as much as 10 droppers. And it's really quite effective, and the simplest. It's the elegant and it's simple. But I'm very impressed with how it's helped people. But again, not willing to put it out there as this is it, so much as we're in a research phase of it. And there is really a difference here. So I'm putting it out in that context rather than as this is a statement, it's the best for parasites. I'm not ready to make that statement. But it's pretty impressive. I'll put it that way. Okay, we can use it as implants as well, which is kind of what I'm saying. It's not like you're doing a 2-liter implant, but half a liter, letting it be for 4 or 6 minutes, and it will get into the blood too that way. So that's really good. Okay, now, it also is mucolytic. It clears mucus, and high doses of it have been very effective in treating chronic lung diseases. And we also use it as a spray into the lungs. I've also seen it being very effective in healing sinuses. What's a sinus? It's an infection, right? So you take like a dropper full, and you put it in a little water, you sniff it in, and I've seen it being definitely effective. So upper respiratory, deep, chronic lung infections. I once had a guy from England, he's still alive. Somewhat amazing. And he came to Arizona and he was really more dead than alive. And we slowly, between oxygen and iodine, which is your two key nutrients, your two key nutrients for apoptosis, and so kind of brought him back to life, and he's still back in England in the wet, damp climate, and he's still living. And he keeps the iodine going because it's a very deep treatment for what we call bronchiectasis, which is kind of a chronic lung infection, and it's working for him. So these are kind of like, I think, important little tips in seeing the big picture of these deep acting kind of lung infections that just aren't clearing with anything else. I mean, he was put on all kinds of things, but there we go, okay?